Today, I'd like to explain about value proposition and the value of business. So the big question is how to make a good business plan. So this is the same question to you all, right? And this is the very basic design thinking way to picture the very high level concept of what is the innovation business. And you need to have three concepts: desirability, which is, people need to desire what you're doing or what you're providing. So if you make something that people don't want, so that's a problem. So you have to make something that people want. And the viability is a kind of, it's an economic viability. So if you make something with $10 and sell it with $1, so you will have a $9 deficit. So it doesn't make sense. So you have to have the profit. So your revenue needs to exceed your cost to make it. So it's just simple thing. That's simple. And the last one is feasibility. So is that business is really carried out in the real world? So technically, scientifically, and any, the business operationally. So can you really do it? So that's the question about the feasibility. And you need to satisfy these three criteria to plan the business. And this is a concept. So what is the desirability and what is the viability and what is the feasibility? I want to break down a little bit. So I will talk about two topics today. So one is the value proposition and what value do you deliver to your customer? So value proposition in Japanese, 提供価値. So what value you want to offer to your customer? And the second topic is the value of business. So how a business value is measured economically.
So if I forget the topic.
Oh, okay. Okay. Okay, I proceed. So the value of the business, the how a business value is measured economically. So this is called 企業価値 in Japanese. And the first topic is the value proposition. And the first question, to think about the first question, to think about the value proposition, the first question will be, who is your payer? Who pays to your business? So this is the first big question. And there are a couple of typical categories of the payer and the type of businesses. And the first one is a B2C business. So this is a B2C business. And it's wrong, it's a B2C. And B2C stands for business to customer or business to consumer. That's a B2C business. And the example is a retail business, so like a flower shop. The flower shop owner, this guy is a business, and his service is provided to customers. So the shop owner to customers. So this is a B2C. And the other examples is the professional businesses such as the physicians, lawyers, and consultants, and they serve to their clients. So not necessarily a patient, the clients like a patient or other people. So this is B2C. And the service business is like a transporter to resident. So like the Kuroneko Yamato, delivering the Amazon stuff to your home. The Kuroneko Yamato is a business and you are the customer, consumer. So this is a B2C business. So this is the B2C. And the next one is a B2B business. And this is a business to business business. And for example, manufacturing businesses such as the drug makers. So drug maker make a drug and sell it to physicians or doctors. And actually doctors provide it to their patients. So doctors do B2C business, but the drug maker do B2B business. So they sell things to businesses. So that's a manufacturing business. And professional businesses can be a B2B. So for example, lawyers and consultants provide their services to businesses. So like a McKinsey and Boston Consulting Group people provide their services to a big corporations. So what they're doing is a B2B business because their clients are business. And the last one is the service businesses. And this is very similar. So transport to company. So if the Kroneko Yamato delivers stuff to your home, that's a B2C business. But if a Kroneko Yamato bring a stuff to Seiko Mart, so that means Seiko Mart will sell that product to the customer. So that Kroneko Yamato does the B2B, because they deliver to business, Seiko Mart. So this is a B2B business. And there's another one, the B2G business. B2G is, oh, I'm sorry, I have a lot of typos today. So B2G business is a business to government. And for example, the construction businesses, construction workers, so they develop things for, public, like a public hall, parks, stations, and those type of things. And the sponsor of the project is a government. So they do business for the government. So that's a B2G. And the healthcare businesses in general are part of the B2G business because the doctors provide a service to patients. And in Japan, only 20 or 30% of the money comes from the patients out of pocket. And the remaining 60 to 70% of the money comes from the government. And this is the insurance. And in Japan, the health insurance is owned by the Japanese government. And the money paid back from the government is called a reimbursement. So this type of reimbursement business is kind of B2G business. And the last one, the education business. So for example, like a professor at the Hokkaido University, they are the semi-quasi public servant. So they work for the government because the government or the school pay them their wages, their salaries to the professors, right? So their direct client is the government, but they face the students to provide the services. So in this case, the beneficiary, the students, and the payer, the governments are different. So this happens in the government business. So that's the kind of three typical business models. And in each business type, uh, they have their own key decision-making drivers. So for example, a B2C business, the key decision-making driver is emotional value. So if the customer likes it, they buy it. And if customer doesn't like it, they rarely buy it. Functionality and other factors are important, but the most important one is the emotional value in to see business. So the important activities would be marketing activities and branding activities. So just imagine that the Unilever and P&G and those consumer-facing businesses, they spend tons of money for their marketing and branding. So because the key decision-making driver is the emotional thing. So that's the B2C business. And the B2B business, because this is for business, for professionals, so they don't care about the emotional value. They care only about the economic value. So, so in the B2B businesses, so you need to have a better functionality, or you need to show the efficiency of the business or something like that. And you need to offer to the business that if you work together with me, probably you can make this amount of money, or you can reduce your cost by this amount or something like that. So that's the B2B business decision making driver. And the B2G business, this is a political value. So this is very tricky because it depends on the government. If the city government, they wanted to foster the industries in or economics of the city. So if you work with the Sapporo city government, you need to contribute to Sapporo city. But if you work with the Japanese government, probably you have to contribute to the entire Japan. And if you work with United Nations or WHO or those global organizations, you need to contribute to the world. So depends on the your client, the government, your scope will be different. And the what you're gonna do with the government needs to be very, very agreeable with many people. So it's not about your only about your passion or science or consumer preference. It's more about the agreeability. So, uh, so uh, it's not only about your customer, but it's also about how the decision making happens, and you have to adjust your business plan to maximize the potential of it. And once you set your payer or customer, you decide my customer is a government or your customer is a consumer or something like that. Once you set it, and then next question is what is payer's pain? So you have to solve the pain of your customer. And to think about the customer's pain, this is a very famous the framework called the value proposition canvas. Probably some of you may see it before. And on the right side is about your customer or your payer. So what is your customer's job? So my customer's job is to eat something for their health, or my customer's job is to move from point A to B or something like that. So this can be very abstract or very specific, but the customer's job is some task that the customer want or need to do. So that's the customer job. And the gains and pains are the gains is the gain that can be provided by this service. And the pain, I'm sorry, the gains is that the gain from this job. So like moving from point A to B, the gain is they can reach to the point B and do something or meet someone or something like that. That's the gain. And the pain is that the pain caused by this job. So unless if you move point A to B, probably you will pay money a lot, or you will spend time a lot or something like that. So this is the pain is related to your job. And the left-hand side, so this is your side, the service provider side. And the products and services, this is simple. So maybe your smartphone app or your service business you're planning, or your new product with your innovation or something like that. So this is your business. And just break down it into gain creators and pain relievers. And your product, how your product will create the gains for your customer, or how your product will relieve the customer's pain that they have or something like that. So this is a very simple but very important framework. And this is example, Amazon. So Amazon customer, actually they have two customers. One is a consumer and the other is a business, because at the Amazon platform, other, the makers can sell their product on Amazon platform, and the consumer can buy it on the Amazon platform, right? So the Amazon have a both facing the business. So their customers paying for the end users, they wanted to buy the product. So this is their job, the consumer job. And for the businesses, they want to sell their products. So that's their job. And the gain is that for the end users, if they buy products, then they can use the product. So this simple. And for the businesses on the Amazon platform, they wanted to revenue by selling their products, right? So this is simple. And the pain is for users, for the consumers, they need to invest their time and money to go to shops to get something, right? And for businesses, they need to gather customers to their retail shop or something like that. So that's their pain. And the Amazon, the solution provider, provide a shop in the internet, the biggest retail shop in the internet, right? And the biggest retail shop in the internet can create access to product for the users and access to consumer for the businesses on top of that. So what they're doing can increase the gains and decrease the pains for both sides. And the I'm sorry, I missed this part. And the Amazon also provide the easy logistics, so they can help the businesses to ship out, and the consumers can receive the product by arranging the order logistics. So this is the pain reliever. So the Amazon's value proposition is very well designed. And as I mentioned earlier, the consumer care about the emotion, and the businesses care about their economics. And in this scheme, the Amazon helps consumers emotionally, because the consumers feels a little bit tedious. It's a little bit hassle to go to shops, but by using the Amazon platform, the consumer doesn't need to worry about that. So it's an emotional value. And for the businesses, Amazon provide the economic value to the businesses, because if a business needs to open up a real physical shop and do some promotion advertisement to gather the consumers, that costs a lot. But on Amazon, they can easy to access to the customer. So it's more about their economic, the value. So the Amazon's business plan is very, very well designed. And this is just on the side note. There's a two type of values, and the one value is something nice to have, and the other one is something must have. And the nice to have business, like a flower shop. Flower, it's nice if you have a flower, but you won't die even if you don't have a flowers, right? So this is nice to have businesses. So if you do a lifestyle businesses like a flower shop or some restaurant or something like that, probably that business must be nice to have thing. And the must-have thing is like operations, the medical businesses, because people will die unless they don't get it. So this is kind of essential work, and the most of disruptive businesses and innovative businesses, such as technological startups, are providing must-have values, not the nice-to-have values. So if you wanted to make a huge impact, you have to think about the must-have value. And after this, Tats will explain about the obesity, but the obesity business is a little bit tricky, so I'll explain how. So this is just an example. So if you think about the AI doctor to provide advice to obese people to live healthier or something like that. So like a smartphone app that tells the obese people don't eat or run a lot or something like that. And actually, it doesn't make sense in this value proposition canvas. I'll explain why. So the customer's job, the obesity people's job, they know they wanted to lose weight. So, but the actual business is not to lose weight, because most of the obese people would say this: I want to lose my weight, but I failed. So please make me thin without struggles such as food restriction or exercises. So they were in some way to get thin without any hustle. So that's what they really want. So so their gain is, by losing the weight. So it itself is the gain, but the pain is by losing the weight. But the process of losing the weight will cause, bad feeling. So I don't feel good to be an obese, but I'm afraid of dying early. So uh, this type of customer is the main target. And if the AI chatbot to give advice, so you should not eat or you should run or something like that, and the doctor AI will tell the consumers that I tell you not to eat or something like that, but the consumer will say that I hate it. I just don't want to get scolded, or I don't need any bosses for my life or something like that. So it's just annoying. And the pain reliever, so I help you not to eat by advising that this is the same. So the consumers hate it. So the problem is they wanted to get thin, but they don't want it to went through all the struggles. So the student business ideas often fell into these pitfalls. Students often think about this type of thing. So I'm doing the right things and I'm saying the true things, but oftentimes the consumers, I hate it and or I don't want it. So this is the big problem for the this type of businesses. And this type of business is so-called the behavior change businesses. So behavior change. So you want your customer change their behaviors and get some gains, but changing the behavior is very painful. So how can you solve it? And there will be two different approaches. One is a north wind approach, and the other is the sun approach. Probably you have read the child book, the called the North Wind and the Sun. And the North Wind approach is to punish your client and let them do something. And this is a very funny example. The Pavlok, and this is a wearable, and for the people to not to eat sweet or potato chips or something like that. And the mechanism is simple. It has an electric shock, and if user eat the potato chips, they wanted to push the button and feel the very painful electric shock, and that will train the brain of the users not to feel good by eating potato chips. So it's a negative Pavlov dog type of approach. And this is very interesting, but it actually didn't work. So because people won't push that painful button after eating the potato chips, people are not that disciplined. So that's the real world. And the doctor's advice and teacher's advice and your AI chatbot advice would be very similar to this. If you punish your user, probably they will stop using it. So this is the north wind approach. And how about the other, the sun, not sun wind, the sun approach. So you just encourage the users to do better things, and but they need to go through struggling, so they hate it. So how do you motivate your users? So that's the big questions. And in the psychological theories, there are two very strong motivators. One is financial incentives. So if you do this, I know it's painful, but I'll give you money if you do this. So this is the financial incentive. So this works very well. And this works very well, especially for the elderly people. But it costs a lot because you need to give up money to your customer. So you need a good business model to finance this money. And so this is a financial incentive. And another good approach is a gamification. So Pokemon Go is a very good example. People start working and doing the exercise without any, advice from the doctors. They just wanted to catch another Pokemon by, finding that around the city. So the gamification is very strong, but sometimes it just works it works for the younger people, but for the elderly people, it's not necessarily working always. And the people get bored of it if you do it for a certain period of time. So you need to entertain the users almost forever. So this will be the very big problem to offer the gamification approach. And the gamification is very well researched, and the many psychologists and market analysts did a lot of researches, and there's a many good books about the theory behind the gamification. And this is a very famous one. The book named the Hooked, and in Japanese, it's Hamaru Shikake, and the how to make people addicted to anything. And it's a simple. So the first one is they need trigger. So for example, they just download the Pokemon Go app and find the first one and figure out how to catch the first Pokemon or something like that. Okay, I understand it. And then next one, the first trigger is okay. People does Pokemon Go a lot, so I want to do it. So that's the internal trigger, the first trigger. And then the next one is probably the user go out to a city and the catch a Pokemon. Okay, oh, it's fun. I took action and get the fun. And then this is the most important part, that the variable rewards. The users needs to fail sometimes. I mean, the reward needs to be probabilistic. So if you do it and get it with a 100% possibilities, people will just get bored of it. But if you do it and get it, if you do it and get it, but if you do it and then don't get it, sometimes you don't get it. So this part is very important to get people addicted to that type of activities. So this is the mechanism that the Facebook and the Instagram, Twitters, and those things are built in this mechanism to get people addicted to their platform. And this is a cycle of the getting people addicted. So this will be very helpful for you to think about this mechanism for good thing. And actually this type of mechanism are built in many startup services in the United States. So this is just example. Omada Health is the service for diabetes people, and this is a very famous and a very popular one. And they use that type of hooked, addictive the technologies in it to let people get exercise or something like that. So that's the first part, and I will quickly go through the value of the business. And as I said, the most important thing is that unit economics. So if you put some money on your business, and you will get return, the output, and your input needs to be much smaller than your output. And sometimes the students design a business to input $10 and get just $1 or something like that. So it just simply doesn't make sense. So it needs to get more money than your investment. And okay, for the interest of the time, I will skip the value of business. And so the first framework, so desirability. So how can you design a good value proposition that is desired by your customer? So it's not simple. It's not simple. So you have to think deeper. And the viability, it's relatively simple. So you need get more output than your input. So just be careful of it. And the feasibility is, it's all about the science and technology. So probably because you're from the university, probably you are good at it. So I don't worry about it too much. So I hope this would help you to plan out your business plan. So I think I have just 1 or 2 minutes. So if you have any questions, I can answer 1 or 2. Okay. Okay, so let's get to the Tatsu's part, and he will explain about the problem that he has actually now, and we want to hear the good idea and the good business model from you. Okay, Tatsu.
Okay. So is my screen shared all right? Right. So in this session, so I would like to introduce to you one of the global serious issue, the obesity, which we have to face now. And later on, I will also introduce some examples of the startups which are trying to solve the obesity problem in worldwide to give you some idea of the business. I just added my brief introduction here because I didn't expect I didn't have time to actually do the introduction beforehand. But let me introduce myself briefly again. So I'm Tat, and Taku has graduated Hokkaido University, but I'm not actually related to the Hokkaido University at all. I finished my PhD course in Waseda University and studying actually the algae, the plants. So actually I was originally the algae, a plant person, but because I was more interested to the human health, I decided to join to the Metabogenomics Incorporated, the science-based healthcare company focusing on the gut environment. So basically the bacteria living in our large intestine, how they are working, how they are affecting to our health. And I was originally joined to the company as researchers. Last year, I appointed to the global business department. And this year, we have established a new international subsidiary in Singapore. And I appointed as CEO. So basically, I'm originally the science person. And I'm also the newbie of the fields of the business planning and development. So I'm quite excited to actually hearing and discussing the idea of the business from all of you today. So the topic which I would like to introduce you is obesity. So maybe the obesity is now very familiar health issue for all of you. You will see one or two people who are quite fat when you go out for the shopping. But so it is quite familiar now, but still nowadays the obesity has become the serious global threat in various perspectives. So we definitely require to face the significant issue. And it is no exaggeration to say that across the globe, the obesity and its associated medical condition have reached to the crisis proportions. So of course, the obesity itself has direct linking to the health risk. Nowadays, obesity itself and its associated disease is actually killing 2.8 million people per year. And that is nearly responsible for about 5% of all deaths worldwide. So actually the health risk of the obesity is enormous. And not only for the health risk, the obesity is also causing an economic impact. The reports of the McKinsey in 2014 have reported that the economic impact caused by the obesity is worth about $2 trillion per year. And this is nearly equivalent to the global impact of the smoking or the armed violence, war, and terrorism. So basically saying the economic impact caused by the obesity is almost same as the war and the terrorism. So it's actually enormous. And one of the reasons why the obesity actually causing an impact is educational outcome and labor force productivity reduction. This is sound a little bit discriminative to hear, but there is some reports saying that on average, boys and girls and men and female work in the school or the company have less performance and less productivity when they are obese compared to the people with the healthy weight. the economic impact caused by the obesity is not only caused by this performance-related matter. It is also caused by the medical fee or the insurance related fee, which also making a huge economic impact. But at least in some aspects, the obesity is also causing the negative impact on the educational outcome and productivity in some companies. And more recent topic, it has been reported that being obesity is a huge risk in the current COVID situation. The obese people are more likely to be infected by the COVID virus, generally because their immunity condition is more messed up by the obesity. And also, when they're actually infected, its health risk is more severe than the health weight people. So in addition to the general health risk and also the economic impact, the new risk to be obese is brought to light in the current COVID pandemic. So the obesity has a huge impact in worldwide, but the problem is even the people understand the impact of obesity. The prevalence of the obesity is still rising, even in the developed economies. So the obesity prevalence has been tripled since 1975, and almost about 40% of adults are now overweighted. And some reports of the McKinsey have said that there will be the half of population will be actually overweighted by the 2030. So it will definitely continue to increase, and actually we have to stop them. And one point which I really want you to actually focus is here. Can you see my pointer? Maybe not. But the point which I want you to focus is actually the child obesity, because currently there is 38 million children who are actually overweighted or obesity. Interestingly, these children, almost half of the obese children, so nearly 19 million people are actually living in Asia. So there is a significant explosion of the obese children occurring in the Asian region. I just wrote this graph showing how number of obese children is raised in each region from the medical research journal Lancet, which published 2017. This graph is just generally showing the color of the graph generally showing the number of the children who are obese in each region. Blue color showing Europe, children in the Europe region. The green color is showing America, and orangey color showing Asia, and reddy color showing the Africa. And you can see that compared to the increase in America and Europe, which are shown in green and blue color respectively, there is a much faster increase of number of the obese children observed in Asia and Africa region, which are shown in red and orange color. Actually, there is the logarithmic increase of the obese children occurring in Asian region. And what this data is actually indicating is that there will be a significant increase in obese population expected in Asian in future, because it has been reported that the BMI in childhood to young adulthood is strongly associated to future BMI. This is very recent paper published by the Journal of American Medical Association Cardiology. But this paper have reported that the BMI in young adulthood was the strongest factor associating with the future BMI, and even greater than the cardiorespiratory fitness. So in other words, what that means is you will likely to be overweight if you were overweight in childhood, even if you're doing a jogging or marathon right now. So actually the overweight And the adults is quite a serious problem right now, but also the overweight of the children is a huge risk to make explosion of the population of the obesity in the future. But thinking in different way, if you can stop this increase of obesity in the Asian region, it will lead to great reduction of the obese population in future. So what I want you to think after this session, you will have the time to actually research and discuss about the business model. I would like you to think about the business, how actually support to reduce the number of the child obesity in Asia Pacific. So this is the general summary of what I've talked right now. And from now on, I will introduce some startups which are currently running to solve the obesity issue in worldwide to give you some idea of business. The example which I'm going to talk right now is more focusing on the adult obesity, not specifically on the child obesity. But I think these example would give you some idea of what kind of business would be actually useful to prevent the obese problem. Right, so of course there are many strategies to prevent obesity, but one of the simplest way is make people not to eat, as Taku has explained. But of course, people love to eat, they can't really stop to eating. But what this company, Reshape Life Science, have been doing is force them to reduce their amount of food proportion. So what they are providing is actually the medical device called lap band, adjustable gastric band, which is placed around the upper part of the stomach, as shown in the figure on the left bottom. So the stomach will be shrinked to the smaller pouch and to make people to eat smaller portion of food. And the business is based on the B2B model. So basically what they are doing is providing this medical device to the medical institutes. And of course, why they're providing this device not directly to the customer is because, of course, to place this device into their people's stomach, the surgeon specialist is required. And of course, the number and the scale of the surgeon is uncontrollable by the company. So this is that is a little bit difficult point of this business, I presume, but still they're making not bad results and getting some revenues. And also another direct way to approach to obesity is using a drug. This company, Lobesti, this is also the company of the United States, is actually developing the monoclonal antibody, the drug basically, of the protein called gastric inhibitory polypeptide. So this is a factor related to the development of the type 2 diabetes and obesity. And this antibody will bind to this peptide to prevent peptide to bind to the receptor to cause type 2 diabetes or make people more likely to eat to reduce the obesity in general. They haven't actually started the service open yet, so I'm not really sure what the price will be and how much the revenue they will have. But still, the drug is of course the effective way to dealing with the health issues. So I just introduced this company as well. And of course, as the Taku has introduced several examples, the recent hot fashion in healthcare is the personalized healthcare. And this company, the Phenomic Sciences, are actually providing the personalized healthcare approaching for the obesity. What they're basically doing is providing the blood test to identify what type of obesity you are. So the obesity would be originated by the brain, or the more like the gastric pattern, or the emotional, or the more like the energy burning, according to them. So they will identify what kind of type of obesity you have. And after that, the information will be provided to the healthcare provider, and they will provide you some personalized approach to lose weight more efficiently. And this one is also under the clinical trial since 2019. So the service is not open yet. So the price is unknown, but I presume they will have some kind of efficient effects for the obesity approach. And this is also another personalized healthcare service provided by the United States company. The company called Bio. This is the company focusing on gut microbiota, as we are also doing. And what they are doing is providing the tests for the genomic host genome, and also to the gut microbiome, to identify your body condition. And after that, they will provide you your suitable supplements. They will basically make the cocktail of the ingredient and put into the capsules and provide you as a supplement to improve your health more efficiently. And they are providing evaluation service and supplements in $200 per month. So I'm not quite sure whether you think this is expensive or not, but at least they are getting a revenue. And also recently they have dropped the price from 600 to 200. So there's a dramatic drop. So maybe it will be getting more popular soon. And this is more like the behavioral change, personalized healthcare. The company called Noom is providing the personalized weight loss coach smartphone application based on the artificial intelligence and the real trainers. So basically what they are doing is suggesting the food and training, but of course, as Tak has explained in his examples, just suggesting the food and training. So don't eat and do more fitness. It's not really make people motivated. So they are actually also putting the real human trainers in their service to have some conversation inside the application using a messenger-like application, and try to focusing on your general behavior and motivation, and try to adjust the suggestion in real time. And they are providing their application subscription for $60 per month. So it is nearly equivalent to, or slightly cheaper than just going to the fitness gym. So maybe this is one of the alternatives for some people for actually losing weight efficiently. And this application is quite famous now in worldwide, even Japan, and they are getting quite good revenue, $390 million in 2019. And when we speak to the behavior changing, of course, I also should mention about the Pokemon Go developed by Niantic. This application has successfully made 43% of trainers to actually lose their weight. So this is actually the tremendous application in aspect of the obesity problem solution. This application, of course, is not originally developed for the obesity solution, but as a result, actually, they managed to people to lose weight. And the important point is this Pokemon Go's business model is very clever. Of course, as Tak has mentioned, making profit is very important for the startup or the business. And for the normal gaming application, base payer is simple application player. So people will pay money to the company to play game more comfortably or more faster. But that profit would be relatively small. Well, it depends on the game, but generally saying it's quite small. But this game is actually also creates the new business model for actually offering people, the people like the shop or the restaurants, to be the location sponsorship. So basically, this game is GPS-based game. So player are actually moving around. So this game can actually motivate people to visit to a specific place. So the shop or the restaurant or whatever is actually paying the Niantic to put this Pokestop, the place for the event, to their place, to make players to visit to their place, and just not for playing game, but also visiting visit to the place as a customer for some restaurant shop. And this business model is actually significant, and actually they have got the revenue of the nearly 900 mil just for Pokemon Go in 2019, I think it was. So this is quite tremendous business model which recently established. So this is just a general introduction of the example. I only introduced 6 startups because of the time limited, but there are many strategies exist to challenge the obesity issue. So, and also, as Taku has explained in the previous session, considering business model and profit is also the important point. So that's why I explained the Niantic example. So